Stress Physiology, the real symptoms of diabetes that we misunderstood. Hi, everyone. This is Real Easy Med Terms. In this session, we will learn about stress physiology, the real symptoms of diabetes that we misunderstood, Chapter 5. The process of complications of diabetes. 5. The process of complications of diabetes. Humans cannot detect chemical reactions that occur at the cellular level, or the secretion and reabsorption of ions by the kidneys. Humans also cannot detect the process, in which hydrogen ions in the blood enter the cells, and the minerals stored in the bones are instead dissolved into the blood. But, the results of that works can be known by humans. In metabolic acidosis, a large amount of minerals are evacuated from the cells, and the concentration of minerals in the blood rises, and the remaining minerals are excreted in the urine through the kidneys. The typical minerals excreted at this time are magnesium and calcium. Therefore, when the production of acidic substances in the body of diabetics increases, at first, magnesium deficiency occurs and calcium deficiency occurs when acidosis becomes more severe. When magnesium and calcium are lost from the bones, the density of the bones decreases, and osteoporosis is easy to occur, and the nails become thin or brittle, and the tooth surface dissolves in acid, making the gaps between the teeth wide. Also, your eyelids shake, you can't sleep well, and you can get constipation. Healthy people may temporarily experience these symptoms, all of them are magnesium deficiency symptoms. These symptoms mean that you are very tired, and your body fluids lean acid, and minerals in your body are lost, so you should take enough rest, reduce intake of acidic foods, and increase intake of alkaline foods. Another problem with acidosis is that the acid denatures the body's proteins. Sprinkling vinegar or lemon while grilling fish makes the fish flesh hard because the acid changes the three-dimensional structure of the protein. Similarly, cells, hormones, enzymes, and antibodies in our body composed of proteins can function normally, only when they maintain a specific three-dimensional structure, but cannot maintain this structure when blood is acidic. When this structure of a protein is broken, its elasticity decreases, and it becomes more susceptible to damage. Along with this, the ability to repair damaged cells is reduced, and the tissues of each organ are deformed, and their function is reduced, resulting in organ failure. That's why acidosis causes abnormalities in the overall metabolism and organ function of the human body. Among them, the liver, pancreas, and kidneys, which have reduced blood supply during stress, are susceptible to acidosis. In particular, when the kidneys deteriorate, acidosis worsens because hydrogen ions and ketone bodies cannot be excreted, and when acidosis worsens, the blood vessels constituting the kidneys are transformed again, leading to a vicious cycle of kidney failure. The complications of diabetes develop slowly, over many years. In particular, since the liver, kidney, and pancreas are silent organs, when symptoms that warrant diagnosis in a hospital appear, complications have already progressed considerably. Therefore, people diagnosed with diabetes should manage, not only blood sugar level from the early stage of diagnosis, but also manage to prevent metabolic acidosis, and the key is to maintain blood pH, weakly alkaline. Even if complications have already progressed considerably, starting pH management can prevent further worsening of complications and improve symptoms. In addition, if you can manage stress, to calm the excitement of the sympathetic nervous system, and activate the parasympathetic nervous system, the cause of diabetes itself will disappear, so you can expect a recovery in health as before. In this class, we learned that minerals such as magnesium and calcium in cells escape to maintain the pH of acidified blood due to diabetic ketoacidosis, resulting in magnesium deficiency and calcium deficiency. In addition, we learned that it is important to manage the pH of the blood with weak alkali because excessively increased hydrogen ions in the blood transform the three-dimensional structure of protein in the body and destroy the tissue. In the next lesson, we will learn about the real management of diabetes, which we misunderstood. This is Real Easy Med Terms. Have a great day. See you again.